Anisha, we are live. Good evening and welcome to IHW Council's special web series on women's health START, supporting treatment in assisted reproductive therapy. I'm Anisha Nair Thapan and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. We are currently seeing the COVID-19 second wave in India a year after its first outbreak. This is just a reminder that we cannot put our guards down. We have to ensure masking, washing our hands, and social distancing. This is also a reminder to put our health before anything else. The arrival of the vaccine and the start of the inoculation process and the lessons from last year have brought hope to millions who want to stay safe and bring about a semblance of their pre-corona days. But there are many who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions of the lockdown and the fear about COVID-19. I'm talking about couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues affecting many young couples. According to the Indian Society of Assisted Reproduction, infertility currently affects 10 to 14% of the Indian population. The scenario is worse in our cities, where 1 in every 6 couples is impacted. Our show today is special, as we're going to discuss aspects related to fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing the treatment and counseling. Project START encourages couples to stay on course for IVF treatment to achieve the goal of parenthood. Today, we will be discussing precautions after IVF treatment. There may be many questions in your mind on what you can do to succeed in starting a family. On our show today, we have an expert joining us to help answer all your queries. Please welcome Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, Bangalore. Welcome to the show, Dr. Rashmi.
Good evening and thank you. Thank you.
Before I begin our conversation, I would like to request our online viewers today to keep sending us their questions in the comment box. Just type it in and we will try to take up as many questions as we can over the next 30 minutes. This is your golden opportunity to get your questions answered by a fertility expert on our show. Do like and comment with your feedback. To share this page with your friends and family members if you think that they can be benefited from the show as well. So let's begin, Dr. Rashmi. Today, what we are discussing is, what to do. What are the precautions to take after an IVF? Now, there is one school of thought that says that pregnancy is a very natural process. So it isn't a disease that requires a special adjustment or a special change. But IVF is not, conception in the natural world. So does it require extra precautions?
What I would want to say is that IVF is one of the methods to achieve pregnancy. And of course, what we actually do in the IVF procedure is just assist the procedure of fertilization so that the embryo formation rate is more. But the embryo grows all by itself. And once the embryo is transferred into the mother's womb, the implantation is also a very, very natural process. Therefore, there is no difference between implantation in a natural pregnancy and in an IVF pregnancy. But the only difference is that because the uterine womb is prepared in a different way in a natural cycle, and in women who go through hormonal replacement therapy to prepare the uterus lining, there could be additional need for progesterone supplements, and that makes the process a little different from the natural one. Apart from that, I feel the most important thing that makes IVF pregnancy different from a natural one is the mindset. When you go through an IVF, you start feeling that you've gone through a treatment process to achieve pregnancy. There's a lot of effort that is put in, a lot of time, and there's a lot of anxiety with respect to what the result will be. and you know that you've gone through a treatment which gives you the maximum success rate. So you are kind of stressed with the procedure itself, and that's why you start taking more care than otherwise. What actually happens in an IVF embryo transfer is we put the embryo inside the uterus, and after transferring, it's about 4 to 5 days within which the implantation process happens. So during this 4 to 5 days, we ask the woman to be a little more careful than otherwise and avoid things like running, jumping, exercising, or doing anything that is vigorous, and even avoid sexual intercourse that can cause uterine contractions, and try to be at ease. Apart from this first 5 days, there's actually no need of taking complete bed rest as such for the rest of the pregnancy at all. But as I told you earlier, it is a mindset that you've gone through a treatment process to achieve pregnancy, and also it's a financially burdening procedure. You've spent your hard earned money for this pregnancy treatment, and that's the reason why you want to do your best with respect to taking care and rest. And this is the only difference, is what I feel.
Right. So, Dr. Rashmi, you spoke about anxiety. So, could that play a role in whether there is successful implantation or not? Is there any truth to being relaxed to be able to conceive, or for the implantation to happen? And just for the sake of those people considering, an IVF treatment or an IVF cycle, what is it like after the transfer happens? So you go home the same day. What are the additional pills that you need to take, or tablets you need to insert? If you could explain that as well.
Yes, the most crucial phase after an IVF is the 15 days after the embryo transfer, the 2 week wait before you test yourself for the pregnancy. These seem to be the most longest 15 days ever. Here, during the embryo transfer procedure, of course, the embryos will be transferred into the uterus, and it's a painless technique, of course. It is not something after which you'll have to stay in the hospital. Some women prefer to take anesthesia during the embryo transfer, especially when their cervix is very tight and when there is difficulty encountered in doing the embryo transfer. They don't want to experience the pain, and they're also scared that the pain can ignite uterine contractions, and that's the reason they opt for general anesthesia or IV sedation. But this is less than 1% of the population, I should say. 99% of women are able to go through the transfer without any assistance of anesthesia or so. After the embryo transfer, they are expected to take rest for about 10 minutes on the same couch where the embryo transfer procedure happens, after which they can stay in the hospital for a couple of hours and then go home and take rest for the next 5 days, as I specified earlier. So there is nothing very difficult, or there is nothing like a procedure kind of a thing which is actually done. It's not a surgical technique, of course. It's just insemination of the semen sample into the uterus, like a thing. I mean, there's not a lot of difference between intrauterine insemination and the embryo transfer. They are the same. Just that in IUI, we put the husband's processed semen sample inside the uterus, and here in embryo transfer, we put the embryos inside the uterus. Otherwise, technically, they remain the same except for the content, I should say. However, after the embryo transfer is done, as you rightly pointed out, anxiety is one thing that reduces the chances for pregnancy. And for women who are working, who are always busy, if they're asked to stay at home for, say, 1 week or 15 days, that gets very difficult. It gets difficult for them to kind of stay in one place. It's very important that during this phase, they try to keep themselves occupied with things that they like to do. It could be listening to music, reading books, watching TV. Of course, we ask them to refrain from using a lot of internet and stay away from the Wi-Fi zones as much as possible, because there are a lot of studies that have proven that Wi-Fi and the mobile radiation can sometimes be harmful. Therefore, we ask them to refrain from that. But yes, reading books and listening to music is something which everybody enjoys to do, and that is something that they should actually indulge in. But the most important thing is thinking about good things. They have to be very positive in their way of thinking that, yes, I am going to be pregnant and things, all good things that I ever thought of would happen now. But there's always one negative thought that keeps coming in the mind. I think most of the women who go through embryo transfer keep thinking about this. They think, what if it is negative? How will I face the world? How will I tell my husband that I have not been able to conceive his child? How will I be able to answer the people who have been here with me to support me for these 2 weeks? So these questions are always there in the mind. And the most important thing is to curb such negative thoughts and have positive thoughts creamed over. And it's not possible practically that you stay for 15 days at home and don't have any negative vibe around. It is all natural to have people around you who would talk something that you don't like and make you feel a little irritated or maybe unhappy. But it is about how we take it. Accept such things with a pinch of salt and say, yes, that's a part of life. It comes in, but this is not going to harm my mental state, or I'm not going to think or ponder about negative things around me. So, this kind of a preparation psychologically to be able to remain calm for all the 15 days is really important. And of course, some women out of anxiety will start checking for their pregnancy test or for beta HCG even before the 2 weeks wait. But I would definitely feel it is advisable to do the beta HCG only after 12 days or so and not earlier, because sometimes it can turn out to be falsely negative. Urine pregnancy tests kits are sometimes not very reliable. So it's not really nice to be testing for the pregnancy every day and seeing one pink line and thinking that it is negative and cry all day. There are people
Right,
who do this. Yes, that's why I'm telling. It's
right.
actually
So,
good
a
to have such a
positive
way.
mental makeup is very important in the entire parenthood journey.
Sure.
Doc- Dr. Rashmi, just wanted to check with you. What about the additional supplements or support, medical support that IVF patients have to take? Could you briefly tell us about that?
Yeah, of course, additional medications are definitely given during pregnancy. Apart from proper diet, proper sleep, and as I told you, allowing all the anxiety away and keeping the mindset positive. Um, Adequate rest, not complete bed rest, adequate rest. It could be called as a modified bed rest, wherein you do light work like cooking and things for yourself. Apart from all of these, there are some medications that are given. These medications are usually the progesterone support medications. And to have a proper serum or a blood level of progesterone, we give injectable progesterones, we give oral progesterones, and vaginal progesterones, either two or all of them. Uh, of course, taking oral progesterones is not very difficult, but vaginal progesterones and injectable progesterones can sometimes be difficult. And here, there is always a choice. If any of these are quite difficult for a lady to use, she can always request the doctor to change them. And apart from that, we give some supplements like folic acid, vitamin E. We also give some multivitamins so as to make sure that the woman is all healthy enough to be able to receive the embryo inside her. Apart from these medications, I think there's nothing much. Some estrogen tablets are given, especially when it is a cycle prepared to do a frozen embryo transfer. And low dose aspirin is given to increase the blood supply to the uterus and prevent any thrombosis that can happen with high doses of progesterone. Of course, as I talk about the low dose aspirin, I should also mention that some women are given low molecular weight heparin, especially when there is endometriosis or conditions that could be autoimmune and may have a difficult implantation process for them. Because low molecular weight heparin, apart from being a blood thinner, apart from increasing blood supply to the lining of the uterus, and apart from reducing the risk for missed abortions later, it is also having an immunomodulating effect. Therefore, there could be injections, tablets, vaginal insertions in these 2 weeks, and most of these would be continued for the first 3 months of the pregnancy, that is between 11 to 12 weeks. These are the medications that every woman is expected to take during those days. But I
Right.
would really recommend all women to take these as things that will aid their pregnancy. I feel some women actually kind of start pitying themselves that they are going through so much to have a child, but they should actually call themselves strong enough to be able to conceive in a way very different from all other women conceive. They are special, they are fighting out things and achieving the pregnancy in the most difficult manner. Otherwise, it's not unnatural or it is not difficult. Anybody who gets married will get pregnant, and that's a very common and a normal process. But achieving it with the struggle should be taken as a matter of pride and not as a self pity.
Okay. We've started getting a few questions, Dr. Rashmi, so I'll take up some of these. A
Yes.
Facebook user is asking if a patient has two embryos, then how many embryos should be transferred at one time?
We usually have a norm of transferring two embryos at once. But of course, if the size of the uterus is small, or in case there are conditions like diabetes, hypertension, or things that will make a twin pregnancy difficult for the lady, then we would opt for a single embryo transfer. And of course, if somebody is beyond the age of 40, we would prefer doing a single embryo transfer rather than a dual embryo transfer to reduce the risk of twinning.
All right. Another question that we have is my AMH is 0. It's 0.05. Will IVF procedure work if my age is 42 with such a low AMH count?
See, with the age of 42 and with the AMH level less than 0.05, of course, it is difficult to achieve pregnancy, but it is not impossible. There are women who have sporadic ovulation despite not getting regular cycles, and one good egg comes out, there is always a chance for pregnancy. There can be a natural pregnancy also with very low AMH and advanced ages. It is definitely not an impossible thing, but yes, it's difficult.
But would you then recommend IVF?
Yes, of course. If at all she is ovulating on her own, a natural cycle IVF can definitely be performed. A couple of natural cycle IVFs can be tried upon before giving up and thinking in terms of a donor eggs. I would definitely recommend at least one honest natural cycle IVF on her.
What is a natural cycle IVF, Dr. Rashmi?
Yeah, in a natural cycle IVF, unlike the conventional IVF, wherein IVF injections are given to increase the number of follicles that grow and go to the stage of ovulation, we kind of wait for the natural follicle that grows all by itself. And once this follicle is about 18 to 19 and when we document LH surge, we trigger them with the HCG shot and then do the ovum pickup or the oocyte retrieval 35 hours later, and then everything falls in place like a natural,
Regular IVF.
like a conventional IVF. The only difference is that we don't give them injections to make the follicles grow. That's because in women who have very low AMH and very low egg reserves, despite giving all possible injections, they end up getting only one or two follicles and one or two eggs. When the yield is only one or two, despite giving injections, then it's better not to give injections and wait for one follicle that grows all by itself and then harvest that itself rather than giving them injections.
All right. Another question that we have is my AMH is 0.52 and my partner's sperm count is less. Can IVF be done in our case?
I think this is an ideal case for an IVF. In fact, IVF should be done in such cases when the sperm count is not good enough to achieve a natural pregnancy, and when the egg count is low and makes pregnancy difficult. IVF is the answer. I mean, ICSI or intracytoplasmic sperm injection is an answer. They should definitely go for it.
So the next question is that is IVF and ICSI the same treatment?
Yes, see, there is a difference between IVF and ICSI. This is something that happens in the lab. In IVF, we let the eggs get fertilized by the sperm naturally. That is, for every egg, X amount of sperms are kept and then they're left for fertilization all by themselves. What happens in ICSI is every egg is injected with one sperm, a morphologically normal looking sperm, with the help of a micromanipulator. The ICSI procedure is something which has to be done when the husband's sperm count is less. If the sperm count is good and all the other parameters are absolutely normal, an IVF treatment can be performed, which is technically less advanced than an ICSI. There's a myth that the fertilization rates are better with ICSI rather than IVF. But however, if the husband's sperm parameters are good, the fertilization rates are definitely comparable in both.
All right. Another question that we have received is before we go to that, I just wanted one clarification from you. You said if the number of sperms is low, then IVF is a good option. Previously, we had a fertility specialist who said that IUI is also a good option for those whose sperm may be slightly lower than normal parameters. So if I have AMH of half and just assume that age is not much, do I need to go for IVF? Can an IUI also help?
See, IUI or IVF can be done when the husband's sperm count is good, but the decision of going in for an IVF or an IUI would depend on several other parameters from the woman's side. If the age is beyond 35 or beyond 40, if at all the AMH is low, or if the fallopian tubes are not really good enough for a natural pregnancy or an IUI pregnancy to happen, in such cases, of course, IVF or ICSI has to be opted for rather than an IUI. But however, if at all IVF has not worked over a couple of times and the woman is not psychologically ready to take up another IVF cycle, in such cases, if the husband's sperm parameters are normal, I would definitely suggest doing natural cycle IUIs rather than not trying anything at all.
All right. Another question that we have is that a Facebook user is saying, I've had two failed IVF. Is there a possibility that a third attempt will be successful? I guess it's all about probabilities, but before somebody goes in for the third cycle, should they then try to investigate why an implantation hasn't happened, or how can things be changed to improve the success rate?
Yes, that's true. After having had two IVF cycles, if at all one thinks in terms of going for the third IVF cycle, we need to be extra vigilant. The extra vigilance has to be for all the parameters, the egg, the sperm, and of course, the uterus. We'll have to understand if the genetics behind the eggs and sperms are right. And when it comes to the uterus, we have to understand if the genetics behind the uterus is also right. So, what we actually do is when somebody has had repeated IVF failures or ICSI failures, we suggest the husband and wife to look for detailed genetic evaluation of both of them. And then in women who have repeated implantation failures despite transferring good embryos, we ask her to go in for an endometrial receptivity array test. After having done all of these, it would be wiser to think in terms of the third IVF cycle. However, if the third IVF cycle also doesn't work, and then if there is a hint about the condition of the embryos not being good enough for pregnancy or the uterus not being good, in such cases, either the egg, the sperm, or the uterus has to be changed depending on where the problem was apparently seen. In cases where the problem is not seen anywhere, I mean, if there are best embryos every time the IVF is done, the uterus is all good to transfer. The ERA test is receptive and transferred in the right window as the ERA. Despite doing all of these, still, if there is a negative pregnancy, then it's better to take decisions like either a donor embryo into the uterus or a surrogacy. However, these are most I would say these are the steps or the decisions that are done at the end if everything else has not worked. So there is never an end to the kind of treatment that one can go through. But what I feel is that for every couple, if there is consistently an attempt to conceive, a try to conceive, and over 3 to 4 cycles, I feel most of them do conceive. It's just that they should be positive and should try consistently. It's just that after a couple of cycles, they lose hope and they feel that it's an impossible thing to achieve pregnancy. They start losing confidence in themselves, and there the trouble starts.
Mm. So that is, your mental makeup is very important. We have another question. For donor IVF cycle, what procedures will be done? What type of eggs can be transferred in a frozen embryo transfer?
In case one opts for a donor egg IVF cycle, selection of the donor and screening of the donor is really important. And here, when you go for a oocyte donor, you have to be sure that the male parameters are all right. Apart from the basic semen analysis, a DNA fragmentation test, and a scrotal Doppler to rule out varicocele, a karyotyping to understand if the husband's sperm parameters are good enough genetically also, is all really important before going in for a donor egg IVF cycle. And understanding if the uterus is good by doing a hysteroscopy or by testing the endometrial vascularity by doing proper Doppler scans is a crucial one. So when one parameter is a donor one, it's important that the other 2 parameters of the egg and the uterus are made, the sperm and the uterus are all fine when you're going for a donor egg cycle.
All right, Dr. Rashmi, thank you so much for joining us this evening and answering so many questions about fertility treatments, IVF especially, and the extra precautions that women must take after undergoing an IVF cycle. Thank you so much for being with us.
Thank you. Thanks for inviting me.
So that is Dr. Rashmi answering all your questions on fertility and IVF treatment during COVID-19. If you have more questions, you can send them to us through WhatsApp. You just have to click on the WhatsApp button that you see on the page. We will try to take up your questions in our next show. Don't forget to follow us to stay updated on all your concerns, your health and well-being. This program is supported by Bharat Serums and Vaccines under its Public Awareness Initiative. We'll be back with our special show on women's health care next week. Do follow us on Facebook to get all the updates on our upcoming shows. Do keep sending us your questions. We'll certainly try to include them in our next show. Till then, stay at home and take care. Goodbye and see you soon.